so as society reopens, we are pursuing two goals, particularly in the United States, two goals that are sometimes in conflict. So one is containing the disease, and the second is keeping society operational. What we've been through now in these last month or two is kind of a version of the all or none solutions, right? So in February, we had the sort of solution 2 on this slide, which is go about your business without restriction, which is the best for normal social and economic activity, but at the expense of controlling the disease. And then this past month, we've seen our version of lockdown or quarantine, which is maximal social distancing, indiscriminately applied, more or less, which is best for disease control, but at the cost of social and economic activity. The goal would be to be somewhere in the middle. And it looks something like this, that we identify everybody who has the disease, both to treat them, but from a public health perspective, people who have the disease are the ones who are going to be infectious and can spread the disease. We identify everybody who has the disease in their infectious period and isolate those people. They're the only ones subject to restriction, and everyone else is free to move around. And this works at the societal level, but it also works at smaller scale too, when thinking about within a school or Stanford University or a workplace. When we are dealing with COVID in the population, how can we contain the disease without bringing everything to a crashing halt? And this is where contact tracing can help. So when we talk about contact tracing for COVID-19, recent contacts of people diagnosed with COVID-19 are at higher likelihood themselves of having and therefore spreading the disease. Contact tracing is the process of identifying those contacts and then reaching out to them and getting them to take a disease transmission limiting activity. So most of us, when we've either heard about contact tracing or think about some of the technical innovations in the last few weeks or months around contact tracing, focus on that first part. It's kind of the detective work of identifying the contacts. But that's only the first part. You need to also get them to take and self-sacrifice for the public good. And for COVID-19, that self-sacrifice is a 14-day quarantine. So to limit going to work, going to school, and just staying quarantined for 14 days in order to prevent disease transmission as we make a determination as to whether they're a case or not. So the first project is around this idea that we formulated, which we refer to as adaptive contact tracing. And this idea that can we develop these data-driven feedback loops to use metrics to power how we do our contact tracing. And historically, contact tracing has been an exercise that's focused on sensitivity. So metrics that people have used for contact tracing are the number of contacts that have been identified for a case, and more is better. The number of those contacts that you've been successfully able to contact or reach, and more is better. And the number of those who've agreed to quarantine, and again, more is better. And at low scale, sensitivity is fine. We don't worry too much about specificity. It's okay to do more is better. But we are not at low scale. So currently we are in the United States discovering still, even following lockdowns, about 20,000 new cases per day. Suppose for an idealized calculation, we identify the contacts of those cases at the beginning of their 14-day quarantine period. It would take only 5 contacts per case for us to be quarantining 1.4 million people under rolling quarantines every day in the United States. If that goes up to 10 contacts a case, which is a number commonly used in simulations, we're talking quarantining 2.8 million people as a part of contact tracing. And at 20 contacts a case, it's over 1% of the US population. So this all seems very far off. Like in the US, we don't even have the capability today to do this kind of contact tracing, but states are committed to hiring people at the order of magnitude where in a few months, our problem may not be that we are not sensitive enough, but that contact tracing is being so disruptive that despite its benefits on disease, on containing the disease, it just becomes a recommendation that's not followed by many in the population. we can develop for that. And the insight that we're going after is that regularly testing a subset of contacts under quarantine can allow us to score and calibrate our tracing efforts. And so we have an agreement with the local public health department to start to build out the infrastructure to power this feedback loop. The second project is around digital exposure notification. So there's been a lot of work on how do we use smartphones to log proximity events in a privacy-preserving way. And these are exciting technologies that are, at this moment, unlikely to be adopted at the 60, 70, 80% adoption rates that are going to be needed to themselves form a backbone for an entire contact tracing effort. But in places that do adopt this, we can actually learn a lot about what kinds of contacts and interactions promote disease transmission and which ones aren't so dangerous. And that, we think, can help us adapt contact tracing, the field as a whole, gleaning insights from these digital exposure notification technologies. And we're in some interesting discussions there.